Hey everyone, Mike Maybach with KTVU Fox 2 in the San Francisco Bay Area. Frontline workers and PTSD during this fight against COVID-19. That's our discussion, that's the topic. And joining us to talk about it, Dr. Shaili Jain, psychiatrist and author and professor at the Stanford Medical School. Doctor, thanks for joining us.
Thanks so much for having me.
So when it comes to doctors, when it comes to nurses, hospital staff, and I was going to phrase this question, if these individuals suffer from PTSD, but you're pretty confident to say that down the road, these individuals, some, will experience PTSD because of what they're doing right now.
Yeah, so the good news is the vast majority of people, healthcare workers, frontline workers, they will heal naturally with time from the psychological injuries of dealing with this pandemic. But a substantial minority, we know from previous disasters, we know a substantial minority of first responders will develop PTSD, but because so many hundreds of thousands of people have been involved in this response, even a small percentage means a lot of people.
Is it something, when it comes to timing, someone could be experiencing PTSD while these individuals are doing what they're doing, or is this something that all of a sudden pops up, maybe a year down the road?
So usually in the moment, people are trained to focus on the task at hand and get the job done, and they're in survival mode. So typically when we talk about psychological injuries, they occur in the weeks and the months afterwards, once that kind of crisis has passed.
Okay. Triggers, something like this, I'm envisioning, I've seen the images of hallways in hospitals, especially in major metropolitan cities, inundated with COVID-19 patients. Maybe it's just the fear of not having PPE or enough of it, someone using a mask over and over again. Are there certain triggers?
There's so many triggers, and it's all unique depending on an individual's experiences. And unfortunately, a lot of these triggers, they're everywhere in the environment, and that's what's so hard. So for example, if you experience something really traumatic in your place of work, and then guess what? You've got to go back to your place of work. Just being in that environment, being around those smells, having those feelings, those can be triggering.
You mentioned at the top of the conversation just about past maybe pandemics that we've experienced. What have we learned about those individuals who worked during those times that maybe will help the doctors and nurses out there today?
So we know, for example, after the 2014 Ebola pandemic, we learned a lot about the way healthcare professionals cope. They are trained to carry on and defer. So they get the job done in the moment, and then they defer the emotions and the psychological processing till later. The problem is when you're dealing with a pandemic, when people are quarantining themselves, separated from family and loved ones, that whole process, that social support you need to kind of process those emotions, that gets interfered with. So that's something we have to pay close attention to, making sure people feel supported after they've gone through this. We know intensity matters. After 9/11, the first responders who were dealing a lot with death and remains, they were much more likely to develop PTSD after 9/11. And we know the state of your hospital or your community before the pandemic hit. After Hurricane Katrina, we learned if you already work in a community that is challenged, that is impoverished, that is low resource, you're probably going to feel more the brunt of the pandemic in the aftermath.
Yeah, it's interesting. You mentioned 9/11, but a lot of those frontline workers, eventually they could go home. Maybe they could see family members. But it is because there is that, if you are in self-quarantine, you are isolated. And that kind of throws a wrinkle into it, that there isn't that support system. And it just shows how important that support system is.
Yeah, absolutely. And then if you think about it, you're working really closely with colleagues. You're almost like battle buddies. You're really dependent on each other. And then if you have to leave those very colleagues because you have to go self-quarantine, or if you get sick, or if your colleagues get sick, it can get very complicated in terms of the emotions. You can feel a lot of survivor guilt for not being there for them.
My sister's a nurse, and I always tell her in California within the UC system, and I say, just make sure you take care of yourself. She's a widow. She lives in a home by herself. She raised her 4 kids. They're out of the house. And that's my biggest concern for her.
Yeah.
You do this great job. You always care for others. But at the end of the day, keep it in your mind that you have to take care of yourself. Is it hard for these individuals, these nurses and doctors and hospital staff to actually think of themselves at a time like this?
Well, like you said really nicely, you have a sister who's a nurse. She's probably been a caregiver for a really long time, probably before she was even a nurse. They're very good at taking care of other people. Self-care is maybe not something a lot of healthcare professionals put first. They're just much more used to putting other people's needs ahead of theirs. So yeah, I think part of this is, I think it's very useful when loved ones remind healthcare professionals to take care of their own health as well. And that's what's been unique about COVID-19. It's put people in this really weird quandary that in taking care of patients, they might be putting themselves and their loved ones at risk. I think that kind of dilemma is what has been uniquely stressful about this pandemic.
I've done a number of stories on PTSD involving, members of the military, our veterans. They come home from war. Right now, we're at war against, a virus. But the effects of PTSD, similar. I mean, these doctors and nurses may experience depression, may experience addiction.
So yeah, even though the cause of the trauma might be different, like you say, combat versus, surviving a wildfire versus living through this pandemic, the symptoms are actually, there's more similarities than there are differences. So they can have those classic flashbacks and nightmares, or they can have the mood states, the shame, the anger, the guilt. And then unfortunately, PTSD, it rarely lives alone. It often goes hand in hand with things like addiction and depression, and unfortunately comes along with a higher rate of suicide, also higher risk of suicide.
If I can take you back to pre COVID-19 and the state of cities and communities, the healthcare system, individual hospitals, uh, if some were prepared for a pandemic or even an emergency and how to handle the community members and dealing with PTSD, and maybe some don't. So, how much of a role, I guess the question is, how much of a role in preparation for this comes into play down the road here?
I think preparation is huge. I feel like if you as a frontline clinician feel supported, feel you're equipped to do your job, feel like you have your resources, you feel very empowered. So I think preparation is huge. And like you say, it's variable. Different hospitals report different experiences. But I think it reminds us that we really have to think more about prevention. I don't know if we always think about prevention as much as we should, but I think COVID-19 has taught us that lesson, the importance of thinking of prevention and preparedness.
Okay, so when it comes to prevention, if you had a launching point, I mean, is it start with just simple outreach?
For prevention of PTSD?
Yes, yeah, yeah.
Well, yeah, so education is key, right? I really believe in name it so you can tame it. A lot of times throughout the centuries, PTSD's kind of lived in the shadows. People don't really have a name for what it is they're experiencing, but I think this education, this talking about it, giving it a name so people can recognize it and say, oh, that might be what I have. And then early intervention is key. If you live for too long with symptoms of PTSD, those symptoms become entrenched, it becomes chronic, it's harder to treat. Getting help as soon as you can makes a massive difference to the prognosis. And the great news is the last 20, 30 years, we have huge numbers of treatments that we can offer people and effectively treat these symptoms. You don't have to be defined by this condition.
So the longer you go, I mean, why does it make it harder to treat? What's different?
Because when people are living with PTSD, they reorganize their life around the PTSD, right? So they avoid all triggers, they might cut themselves off and have this social alienation from people they love. They might turn to alcohol or drugs to self-medicate the symptoms. So it just becomes harder to get at the root symptoms because there's so much complicated layers, that are interfering with people getting help. Plus, naturally, it's really hard to talk about difficult experiences. Our natural human tendency is not want to talk about them.
Yeah.
So already as a professional, you're kind of fighting that, So the earlier you get in, really makes a massive difference. So that's what I would encourage: early intervention and just getting educated about what the signs are. So you're more prepared.
So probably just support from society, not just individual family members and friends, but we as a whole, as one, have to support.
Yeah, support that this can be happen. We don't expect people to be superheroes. There are going to be psychological injuries as a result of these experiences, but we need to have those, not only support people, but also make sure we have those pathways for that psychological rehabilitation so we don't have losses in our healthcare system. We don't lose good doctors and nurses and frontline healthcare professionals to something that we can help prevent.
Are we better equipped? Are we better prepared to treat these individuals for PTSD than, say, we were 20 years ago?
Absolutely. The last 20, 30 years, since 9/11, since the wars in Iraq and Afghanistan, we've seen an exponential increase in the body of research for PTSD. And we really have wonderful treatments now that can, we used to think of PTSD as being disabling or incurable, but that is not the case. These symptoms are very manageable and very treatable.
So what do you think is the biggest difference, doctor, over the last 2 decades?
So a lot of the treatments that we have a lot of talk therapies that really go at the PTSD symptoms. They really get to the heart of that avoidance, and they help people talk through the trauma in a way that puts them back in the driver's seat. That's what I call it. You know, a lot of people are living with PTSD. The trauma is in charge of them, you know, and through treatment, you can help people get back in the driver's seat so that they are once again in charge of their life. So a lot of the talk therapies, those will be the number one thing that comes to my mind that are really effective in helping people recover from this.
In your experience in treating PTSD, and I don't know specifically, you don't have to see any cases if you treated doctors or nurses in the past, but is it hard or difficult for them to say, because look, in the eyes of us, you know, they're heroes, right? And it's hard for a hero to say, I'm hurting or I'm in pain. And is that the biggest hurdle for some of these folks to get over?
Yeah, unfortunately, there's a lot of stigma about mental health, period, you know, across most societies. I think definitely in groups where we expect people to be in control and to be responsible, and we look up to people, I think there's even more stigma in admitting that, okay, things are not okay. So that is definitely a barrier to people seeking help. But, you know, I hope times have changed. I think we think about mental health conditions differently now. You know, just the same way, you know, you develop diabetes, you develop asthma, these things need to be managed. It's the same for mental health conditions. So I'm hoping there's less stigma, but that's definitely an obstacle.
Before we say goodbye, anything else you want to get across to our viewers out there, or to any doctors and nurses, or hospital staff, or firefighters, or police officers?
Yeah, absolutely. I mean, you know, just making sure we have those pathways for psychological rehabilitation. So, you know, these people who have done this incredible work through this really tough time have the help that they need, you know, should they need it. I think that's the vital message to get across.
Yeah, support, support, support.
Yeah.
Doctor, thank you for the discussion. And just want to let our viewers know this interview and a number of different interviews right now about COVID 19 and its impact across the world are airing on our website at coronavirusnow.com. Dr. Shaili Jain, thank you very much. Have a great rest of the week. I appreciate it.
Thanks so much. Stay well.
Okay, you too.